Have you ever imagined a future where surgery isn't the only option when your prostate becomes a problem? For decades, men have been told that invasive surgery is the inevitable solution for an enlarged prostate. But what if I told you that a minimally invasive breakthrough is changing everything? Quietly, without scalpels, stitches, or long recoveries? This isn't science fiction. It's called prostate artery embolization, PAE, and it's one of the fastest growing alternatives that men around the world are beginning to discover. Instead of removing or cutting, this procedure works by blocking the blood supply to the enlarged prostate, shrinking it naturally. For many, that means freedom from endless medications, painful symptoms, and the fear of being wheeled into an operating room. Now, you might be wondering, is it really that effective? Is it safe? And why haven't I heard about it before? Those are exactly the questions we're going to explore today. By the end of this video, you'll know why this procedure is being called a game changer in men's health, and whether it could be the option that spares you from surgery forever. But before we dive in, make sure you subscribe and turn on notifications. That way you'll always stay ahead of the curve on the latest breakthroughs shaping men's health and future well-being. Prostate artery embolization, or PAE, is a minimally invasive procedure performed by an interventional radiologist. Instead of making a surgical cut, the doctor threads a tiny catheter through an artery in the wrist or groin. Using imaging guidance, they direct it to the arteries feeding the prostate. Then microscopic beads are released to block the blood flow to the enlarged tissue. Over time, the prostate begins to shrink, relieving pressure on the bladder and restoring normal urinary flow. The beauty of this procedure lies in its precision. Only the arteries supplying the prostate are targeted, while the rest of the body is left untouched. What makes PAE revolutionary is that it often requires no overnight hospital stay and has far fewer risks compared to traditional prostate surgery. Instead of weeks of recovery, most men resume normal activities within a few days. In 2017, a landmark study published in The Lancet compared PAE to the most common surgical option, TURP, transurethral resection of the prostate. The research followed 80 men and found that PAE provided significant symptom relief with fewer complications and a shorter recovery time. Even more striking, patient satisfaction rates with PAE were nearly identical to those who had surgery, proving that a less invasive option can deliver equal, if not better, outcomes. For men, this isn't just about medical science. It's about quality of life. Imagine being able to walk out of the hospital the same day without a catheter and without the fear of permanent side effects like sexual dysfunction or incontinence, complications that traditional surgery often carries. PAE offers men the chance to regain control of their health with less disruption to their daily lives. It's not just a medical breakthrough, it's freedom wrapped in modern technology. For many men, prostate problems are not just about discomfort. They are about identity, confidence, and independence. Issues like frequent urination, interrupted sleep, or difficulty starting and stopping can quietly erode a man's sense of control over his body. Traditional surgery may solve the problem, but the thought of going under the knife and risking complications leaves many men hesitant, often delaying treatment until symptoms become unbearable. This is why prostate artery embolization is such a game changer. It gives men the option to address prostate issues earlier without the fear of invasive surgery. By reducing risks and speeding up recovery, PAE makes it easier for men to take action before their health spirals into bigger problems. It transforms treatment from something frightening into something approachable. The bigger picture is simple. Men no longer have to choose between suffering in silence or facing major surgery. With PAE, they gain a middle ground, effective, safe, and minimally disruptive. It's a way of preserving not just health, but dignity and quality of life. Prostate problems don't have to control your life, and surgery doesn't have to be the only answer. Prostate artery embolization is showing men everywhere that there's a safer, less invasive path to recovery. If this video opened your eyes, share it with someone who might need to hear it. Don't forget to subscribe and turn on notifications so you don't miss more breakthroughs like this. Your health is your power. Protect it and let it protect you.